Thank you to our panelists and to Dr. B for moderating and for your thoughtful reflections. At this time, I would like to introduce our final speaker, Dr. Beverly Malone. Dr. Malone is the president and CEO of the National League for Nursing. Under Dr. Malone's leadership, the NLN has advanced the science of nursing education by promoting greater collaboration among stakeholders, increasing diversity in nursing and nursing education, and advancing excellence in care for patients. Dr. Malone's distinguished career has mixed policy, education, administration, and clinical practice, including as Federal Deputy Assistant Secretary for Health under President Bill Clinton.
Thank you so much. I'm delighted to be here. If you don't have a healthy planet, you can't have healthy people. And I'm a nurse, and we're into health. Caring is all about a health system, not an illness system. And so there's a lot of concern within nursing and within healthcare about where we are right now with climate, where we are with with the justice system around climate, and how we can do a better job of making sure that our people, the people that we care for, are getting the care that they need. And that care includes an understanding of climate. I think about African American people because I am an African American person. And one of the things that comes to my mind frequently is that it just didn't start today. And I heard a colleague talking about indigenous people and Native Americans, and I'm thinking, yes, and African Americans, 1619, when that ship came over, that's when things actually started. And what happened during that was a continuation of that. And the tentacles of racism have invaded our system in an incredible way. And it's invaded in terms of the food deserts that we have. It's invaded it in terms of even the way that we think about disasters and what happens after the disaster leaves. Who gets build back, build better? Where does that happen? And how does it happen in an appropriate way? And I'm hoping that things are off to change in terms of how that goes for the American people, but for African American people and for indigenous people. I'm also thinking about the issue of climate change in terms of healthcare, just on the units, and how we prepare our nurses, our physicians, and our other healthcare providers. And so I have to go back actually to our faculty members, see how they're preparing those providers, how they're preparing the clinicians. And what I can tell you is that if they're not prepared, they cannot prepare others. And frequently, nurses, physicians, we teach the way we are taught if we're faculty members. And so those are issues too. And all of these issues come together around bringing together an issue of making sure that climate change is a part of healthcare, a part of how we view it. When I was growing up, just to give you an example, I used to go out with my little red wagon to the railroad station and pick up coal because we had a coal stove in our house. And I was honored as a child to go out and pick up coal and bring it back to the house to keep it warm, not knowing what danger or what the probabilities were in terms of making a difference in the lives of my family and all the people in my community. We know better now, and we have an opportunity to do better. And healthcare has to include climate change in the teaching, in the knowing, in how we research, in how we make things happen. Thank you, Tia.